Good evening, everyone. I am Dr. Ashwini Gadde, currently working as consultant nephrologist in Fortis Hospital, Gurgaon. So our kidneys do important function of excretion of toxins and maintaining the acid base and electrolyte balance in the body. And whenever there is kidney disease, kidneys lose that ability, which results in increased disbalance between these electrolytes and acid base. So the intent of dietary modification is basically to decrease the generation of these toxins and help kidney maintain this acid and base and electrolyte regulations, basically to deload the kidneys. Unfortunately, many a times we see that these dietary modifications are done overzealously without any monitoring, which can cause more harm, which can cause protein energy malnutrition, which can cause more morbidity and even death, even before the kidney disease would cause it. So before doing any dietary interventions, it's very important to know that what is patient's current nutritional status, what's his current intake, what's his BMI, what's his weight, what's his CKD stage, basically the severity of kidney disease. Equally important is to know the patient's intentions and management plans about his future kidney disease, whether he's willing for dialysis, not willing for dialysis. So if we take the overlook of the dietary modification, so calorie intake, calorie requirement in a CKD patients is almost similar as of general population, which is around 25 to 35 kilocalories per kg per day. What's different is they are advised low protein diet. Now, there are different recommendations and there are different protocols to follow, but most of the time it's around 0.6 to 0.8 gram per kg per day. Now, low protein diet doesn't mean that you exclude all your protein rich diets. So we see many a times in the OPD, people cut down on their dal, paneer, milk and milk products, everything. So you really need to see whether you really need that restriction. See, most of the Indian diets, if especially the vegetarian diets, are unable to reach this minimum protein requirement. So reducing over and above that low protein will cause more harm, which will cause more protein energy malnutrition. So before doing these interventions, you basically need to know what's your current intake. So visit your nutritionist or physician before you decrease on your protein intake. Whenever you decrease on your protein intake, also important that you simultaneously increase your calorie intake so as to balance the requirements. And whenever these modifications are done, you make sure that you are getting a 3-monthly assessment so that you will not have harms related to decrease in protein intake. So monitoring basically. So other important modifications which are important is low salt and low potassium diet. Now, low salt diet, which is generally required around 2 to 3 grams of salt per day, will help you achieve better BP control, will help you decrease your fluid overload, decrease swelling, decrease breathlessness. So that's important. Now, low potassium diet, you need to know what are high potassium diet first. So fruit juices, coconut water, dry fruits, green leafy vegetables, especially citrus fruit, these are rich in potassium. That doesn't mean you need to completely avoid that. It depends upon what's your current potassium status. Few patients might need very stringent control, but if your potassium is hovering in a normal range, which your nephrologist can tell, in that case, you with proper spacing and the proper portion control, you might have some of these high protein foods also. So after low protein and low potassium diet, what's important is fluid restriction. Now, whenever you have a kidney disease, your kidneys lose ability to dilute the urine. So your kidneys will produce a fixed amount of urine. So if you take more than that, it goes on accumulating in your body, causing this swelling and breathlessness, basically the overload. So you need to roughly have an idea what's your urine output, what's your kidney stage, and what's your current fluid status, for which your nephrologist can guide you. And accordingly, you need to reduce on your fluid intake also. Now, low phosphorus diet is needed But whenever you decrease on your protein intake, it automatically decreases on your phosphorus intake also. But if your phosphorus is still high, your nephrologist can prescribe you some phosphate lowering pills so that it is maintained. So after all this, what's more important in the end is I would like to again reinforce the fact that these dietary modifications need supervision. Whenever you do the dietary modifications, you need monitoring. Now, this situation gets more worse, especially if patient has poor appetite, poor oral intake. And in that case, even we need to supplement the patients for their protein intake with nutritional supplements. Now, whenever you choose your nutritional supplements, make sure that they are made for kidney patients. So there are different formulations available, but these formulations which are specifically made and catered to the needs of kidney disease patients, those only you need to choose. So too stringent modifications can cause more harm than good. It's a double-edged sword. So use it with proper guidance. And I'm sure with proper guidance, it will help you to decrease the complications related to kidney disease and to some extent decrease the progression of your kidney disease. Thank you.